Hi everybody! Welcome back to our Live and Learn. We are going to take a minute here and make sure all of our technology is working. We have people joining us from all different social media platforms, so we're so glad you guys are all here today. My name is Jackie, and we will definitely get started in just a second. But while we're waiting to get going, make sure and use that chat button today. Let us know where you guys are coming from. And also let us know if you participated last week in our Live and Learn session about MI. We're so glad you guys are here, and it's going to be a fun time together. All right. All right, good. We are good to go. Awesome. Okay, well, welcome everybody. You guys are here today with for a special topic about heart failure. I want to introduce myself. My name is Jackie, and I work here at UWorld. I have been here about 5 years, and in that time, UWorld has grown so much. Our content has expanded exponentially. We now have over 3,000 questions for you guys to use to help prepare you for your test in nursing school and the NCLEX and just be successful nurses. So, so much has also happened in the world of nursing in the past 5 years too, especially with the NCLEX, like hello, next gen NCLEX. So we're really glad you guys are here today, and I have experience in adult oncology nursing, and just really passionate about nursing education, and want to make you guys successful in everything that you guys are working towards. So last week you guys heard from one of our brilliant nurses on our nursing team, Caitlin, and she talked about MI, or myocardial infarction. And sorry, 1 second. We are going to, we have a little login problem. Let's see. Okay, back in action. All right, so last week you guys heard from Caitlin about MI. So this week we are going to hit another very heavy-hitting hard topic, which is heart failure. So heart failure is so important for you guys to know, not only to be successful on the NCLEX, but also in your classes in nursing school. But when you guys get into practice, heart failure you will see pretty much everywhere. You might be treating clients for heart failure. It might be a comorbidity that your client has when you're treating them for other things. So it's just really important to really understand that, kind of the fundamentals of it. So we will kind of get in. We're going to, I'm lightly calling this Heart Failure 101 because, as you guys know, heart failure is such a gigantic topic. We could probably have a heart failure 102 or 201, I don't know, however the numbers work. So you guys let us know. Put in the chat what you want to hear from us, what you liked about last week, what you're liking about this week, and we want to provide you with content that's really going to be helpful and really be beneficial to you guys. So you tell us what you're needing, what you're wanting, we're listening, and we'll make sure and make that happen for you. So we're going to talk basic fundamental principles of heart failure. We're going to pepper in a little bit of pharmacology. So when you walk away today, you can expect to know manifestations of heart failure, what causes those. So think left versus right-sided heart failure, and some basic meds to treat it. And then we're going to reinforce everything with a question as well. So again, interact with us. Let us know if you have questions. Put them in the chat, and we're really happy to hear from you. Okay, so let's jump in. We're going to start with a question. So we are going to go ahead and pull a question up, and we're going to read through it, and we're going to just use this question to kind of get us started, get our brains thinking, and also see how we need to address the question as well. So, okay, the nurse is reviewing new medication prescriptions for a client with chronic heart failure. So we know we need to know heart failure to answer this question. The nurse should clarify the prescription for. So before we read the option choices, that word clarify is kind of signaling me that this is something that maybe is causing a safety concern for the client. So we want to know which of these medications we're going to question, like which was maybe not going to be the right one for our client. So when we read through these options, the correct answer is going to be the wrong medication. So I know that's a little bit tricky, but I think really kind of breaking down exactly what the question is asking you is really helpful for any test that you're taking in nursing school. But it's one thing to know the content, so it's one thing to know about heart failure, but we need to know what about heart failure we need to know. So with that, you guys totally drop your answer, what you think, in the chat, but we're going to revisit that and kind of now take a minute and dive into heart failure. So, okay, so our options: furosemide, metoprolol, celecoxib. If I'm saying that wrong, totally tell me. Lisinopril. Okay, so now let's talk about heart failure. I want you guys to listen to this sentence and fill in a blank for me. Okay, so heart failure is the inability of the heart to maintain blank blank. So what do you guys think that is? I'll give you a second to answer in the chat. Heart failure is the inability of the heart to maintain blank blank. Okay, let's see what we got. Check in our chat. Seeing some things come in. All right, awesome. Okay, so heart failure is the inability of the heart to maintain adequate cardiac output. So those blanks are cardiac output. So we know cardiac output is the amount of blood being pumped from the heart to deliver oxygen to our vital organs. When that amount of blood that's being pumped out is inadequate, we're going to have inadequate tissue perfusion. When our organs aren't getting enough of that oxygen-rich blood, we're going to have problems. So that is really what we're trying to kind of drive home. Okay, so not only are our organs not receiving oxygen-rich blood, but blood is getting backed up along the way and it's causing congestion. That congestion is going to be in our lungs and in our circulatory system. So we're going to take a step even further back and we're going to talk about how blood flows through the heart. So I want you guys to come along a journey with me. We are going to enter into the body and we are blood. Okay, so, and I am doing my best because I am mirrored. So I think I have this right. I'm doing it reverse, but just stick with me here. Okay, so we are blood. We are somewhere in the body. We just did our ultimate task of delivering oxygen to a very important organ. We have done that. We are now blue blood, so we need to go back to the heart to get oxygen. So we are traveling back to the heart. We are in the venous system. We hit the vena cava. The first stop that we're going to make in the heart is the right atrium. We're going to go right atrium to right ventricle. Now the heart is kind to us in terms of the flow of heart and it being alphabetical. So we're going to hit atriums before ventricles, A before V. So we go venous system, vena cava, right atrium, right ventricle. We're going to shoot over to the lungs through the pulmonary artery. Now you might think artery, I thought that was oxygen-rich blood. That's not the case. Think of artery as in the direction blood is pumping. So arteries take blood away from the heart. So our aorta pushes blood out of the heart, away from the heart, into the body. The pulmonary artery takes blood away from the heart to the lungs to get oxygen. So venous system, vena cava, right atrium, right ventricle, pulmonary artery. We hit the lungs. This is where the magic happens. We go from blue blood to red blood. We get our oxygen. Very exciting. Next stop, pulmonary vein. So again, veins are bringing blood back to the heart. The venous system is bringing that blood to the right atrium. The pulmonary veins are bringing blood to the left atrium. So we're going pulmonary veins, left atrium, left ventricle, big squeeze, pumped out through the aorta to the body. So start to finish one more time. We're doing venous system, vena cava, right atrium, right ventricle, pulmonary artery, lungs, oxygen, we're red blood now. We go back through the pulmonary vein to the left atrium, left ventricle, big squeeze, pumped out through the aorta to the rest of the body. So now that we know all of this, we're going to talk about what it means when we have heart failure. So with heart failure, we can have any number of combinations of problems. We can have acute versus chronic, we can have left versus right-sided heart failure, and we can have systolic versus diastolic. There's so much we can dive into about this, but we're just going to focus on right versus left. So when we say left-sided heart failure, the dysfunction with the heart is with the left side. So that left side is the problem. So we're going to take another kind of hypothetical situation here. So when we say left-sided heart failure, that problem is with the left side. So picture this. The heart is an open system. Blood is running freely. There's no problems. If we come in and we plug up that left side, where is blood going to back into? So think of a coffee stopper. You put a coffee stopper in the left side of the heart. Where is blood going to accumulate first? So you have to work backwards from that blood flow map that we did, and tell me in the chat where blood is going to accumulate first. So left-sided heart failure, left-sided dysfunction, we're plugging it up to visualize where our manifestations are going to take place. Where is blood going to accumulate? What do you guys think? Okay, I think we've got some geniuses in the chat. Very good, everybody. Left side, think lungs. Perfect. So working backwards, when that left side is impaired, blood is going to back up into the lungs. And this is really going to tell us what these manifestations look like with left-sided heart failure. We're going to see a lot of pulmonary features that are going to go on. We're going to see difficulty breathing. Our lungs are going to be congested. When we listen, we're going to see we're going to hear those bad breath sounds like crackles and rails. We're also going to have that pink frothy sputum that clients might cough up. We're also going to see cold, clammy skin. So not only is the problem in the lungs, and if you think about that stopper stopping the left side of the heart, the problem is also going to be below it. So we're not getting that warm, red, oxygen-rich blood to the rest of the body. So our skin is going to be cold and clammy because it's filled with that blue blood that's stuck in our venous system. So we're going to have cold, clammy skin. We're also going to have increased heart rate. So again, talking about that left side of the heart, it's backed up. We don't have as much blood being pumped out of it. Our heart has to compensate. So that cardiac output, as we know, is what perfuses our organs. If that is not adequate, our heart's going to do whatever it can to really satisfy the need that our vital organs have. So our heart rate's going to go up. We're going to pump out little splats of blood instead of these big, like, gushes of blood. And it's going to do its best to kind of maintain status quo for everything. So we're going to have increased heart rate, and then we're going to have weight gain. So weight gain is a common thing, left and right-sided heart failure. It works a little different, but we're going to save that for a little bit more of an in-depth look into heart failure, why that actually happens. So what do you guys think are some causes of left-sided heart failure? What do you guys think? Drop it in the chat. Let's see what we got. What does everybody think? What do you guys think are some common causes of left-sided heart failure? All right, starting to see some things come in. So one of the biggest things is hypertension. So hypertension, when we think about why this is a cause of heart failure, think about your heart trying to pump against the wind. So when you have high blood pressure, your heart has to pump harder to get the same result. So it's almost like running against the wind. You have to work harder to do the same amount of output. So with that, hypertension, big cause of left-sided heart failure. Other things include anything else that's going to impair the pump of the heart. So some of these things include like MI, so damage to that heart muscle, which makes our ventricle maybe weaker, left valve problems and dysrhythmias. Okay, so we know left-sided heart failure. The problem is with the left side of the heart. The manifestations happen in the blood flow pattern before the left side of the heart, which is the lungs. And causes of that can be anything from hypertension to MI, damage to the pump. That's where the real problem lies. Okay, so we're going to make our way over to the right side of the heart. So we've unplugged the left side of the heart for our demonstration here, and blood is flowing freely. Everything is going great. So right-sided heart failure. The issue is with the right side of the heart. We put our plug in. Blood is not getting in. working backwards, tell me in the chat where blood is going to back up with right-sided heart failure. So working backwards, where in that blood flow pattern are you going to see immediate congestion? Let's see what you guys think. Okay, more geniuses. You guys are amazing. You know this. Okay, perfect. So with right-sided heart failure, the problem is with the right side of the heart. The first place blood is going to accumulate is in that venous system. So when we think of blood in that venous system, we're going to think of edema. And a lot of times I think we just think edema in like our lower extremities, but we're going to think of it in all directions from our heart. So below our heart, we're going to see peripheral edema. Above our heart, we're going to see edema as well, and that's going to manifest as distended neck veins. And we're also going to see it in our abdomen as ascites, so we're going to experience some third spacing. Our organs as well are going to have some implications. We're going to have hepatomegaly and splenomegaly, so some inflammation of those organs. Okay. So venous system backs up, blood is in the periphery. What do you guys think is the most common cause of right-sided heart failure? So what do you think is the big implication that leads to right-sided heart failure? Drop it in the chat. Let's see what everybody thinks. Awesome, awesome. All right, if you said left-sided heart failure, you are right. So when our left side of the heart, that blood is backing up into the lungs, when the lungs can no longer handle all of the blood accumulating in there, it's going to continue to work backwards. So it's going to manifest itself into right-sided heart failure. So left-sided heart failure is a primary cause of right-sided heart failure. Other common things can be things like lung disease and also valve problems as well. So how do we manage this? We're going to think about the heart in three kind of elements again. So we want to focus on that blood flow, and this is going to really kind of tie it back to our question again. So we have our heart as our central point of, our central location. We're going to address everything coming into the heart itself, and everything after the heart. So that's kind of just a general principle about how heart failure is treated. So the first thing we want to do is reduce the amount of fluid coming through that venous system that's going to hit the right side of the heart. These kind of medications are things like diuretics, things that are going to pull fluid out of our venous system. And, oh, sorry, I went black, but I'm back. Here we go. Okay, so those are going to be things that reduce the amount of fluid coming into the heart, which would be preload. So again, things like diuretics. Other things are things that are going to maximize the function of the heart. So moving now into that middle part of this kind of segment. Those are things that are going to maximize the squeeze of the heart and also give the heart a little bit of a rest, so things that might lower our heart rate a little bit. And then focusing again on that afterload, so what's getting squeezed out of that left ventricle, which is really our blood pressure. We learned again, hypertension is one of the biggest causes of chronic hypertension is one of the biggest causes of heart failure. So making sure that when the heart is pumping, it's not meeting a lot of resistance. It's able to push and it's able to perfuse our body appropriately. So with that, I think we're ready to look back at our question again. Okay, so again, reading the question. The nurse is reviewing new medication prescriptions for a client with chronic heart failure. The nurse should clarify the prescription for, so again, we want to find the medication that is not safe for this client, something we should question, something we need to take action on, because again, our priority, patient safety. We want to make sure our patients are safe. So furosemide. Furosemide we know is a diuretic. That is addressing our preload. So we know furosemide, definitely going to be something that a client is taking for heart failure. Good to go, not a right answer. Okay, number 2, metoprolol. Metoprolol is going to decrease the strain on the heart. So it's going to lower our heart rate. It's going to give it a little bit of a rest. So this is a beta blocker. Okay, so bonus question. Before you guys give metoprolol, what do you want to assess first? Or let me rephrase that. What should you assess before giving metoprolol? Let us know in the chat. Guys, you are very smart. I'm seeing a lot of good things. Yes, You want to assess heart rate and you want to assess blood pressure. You want to make sure it's safe to give that to your client. I also had a bonus question for number 1. So I'm going to go back and I'm going to ask it because I think it's something that you guys will all know, but it's also very important to know. For furosemide, what electrolyte is do you need to monitor when giving a patient furosemide? Let's drop it in the chat. Yes, very good, guys. Potassium. So that is awesome. You guys really know your meds. Okay, option 3, celecoxib. This is a COX-2 inhibitor, which is a type of NSAID. We know NSAIDs are not safe for our patients with heart failure. So in talking about heart failure, what is happening with the heart? We're having a lot of excess fluid in our venous system. That's putting a lot of strain on our kidneys. Not only are they having to process more fluid, but they maybe aren't getting perfused with that oxygen-rich blood like they should be. So NSAIDs can increase the risk of kidney injury, and we don't want to give that, in combination with that fluid overload, that increased demand on our kidneys, we don't want to give celecoxib to our patients with heart failure. So I'm pretty sure 3 is going to be our right answer, but let's look at number 4, lisinopril. So lisinopril is an ACE inhibitor, so this is going to address that afterload or our blood pressure coming out of our heart. So this is typically something you would give to a patient with heart failure. Can you guys tell me, ACE inhibitors, what do you know about them? What is the one thing you kind of want to monitor, that unwanted side effect that happens with ACE inhibitors? Let's see it in the chat. What do you guys think? Yes, ACE inhibitors can cause kind of an unwanted cough. So that is one thing that is a commonly known side effect about ACE inhibitors. So, all right, so knowing that, our correct answer is 3. We do not give NSAIDs to clients with heart failure because it can increase the risk for kidney injury. So that kind of wraps up what we've learned about heart failure. You guys tell us what more you want to know about. Do you want to hear more about heart failure? Do you want to know more about some of these meds? You tell us, and again, we're going to take your feedback and we're really going to use that to help guide these live and learn sessions, and we hope you will keep coming back. One thing I wanted to touch on too, in UWorld, so if you guys are in the platform, we have over 200 cardiac questions. Not only are these cardiac questions going to address these big topics like heart failure and really give you all that information you need to know, but they're going to be supplemented with these amazing images created by our illustrators, our award-winning illustrators. There's going to be videos, animations, graphics, tables, all of that. That's really going to help your learning. We're going to tell you with these questions why the right answer is right, and we're going to tell you why the wrong answer is wrong. So you're going to learn as you're taking these questions, and then we're going to summarize it for you. So you have all this digestible content that you can use with all of our different product features. You can pull stuff from our explanations, put it on note cards. You can build stacks of note cards. You could build like a heart failure stack of note cards. You could build meds, all these different things that really are going to help you drive home that learning. Again, we are just in the business of helping you guys be successful. We want you guys to be the best nurses you can be, to do the best you can in nursing school, and just be the best nurses when you pass that NCLEX and you're out there helping patients out. So we're so glad that you could join us today. We hope you guys will like and subscribe so you can know when our next Live and Learn session is. Follow us on all of our social media channels, and please don't forget to visit our website. We have a free trial, and we encourage you to check us out. I know once you're in there and you see it, you're going to love it, and you're going to want to be coming back for more. So thanks again for joining, you guys. Let us know if you have any questions, and we hope to see you next time.